please?
Yes, so
How are you doing?
I'm fine. Good to see you.
Good to see you too. How is madam and your children?
Yeah, they are doing very well.
Yeah?
So just give me a moment to check that we are good to go.
Alright.
I was just trying to.
Same here.
Introduction here. This is just our monthly webinar, and today I'm so privileged to have with us Dr. Mrs. Odemela. Is our guest for tonight, and she's a senior colleague. I've known her for quite a while now, and she's a child of God. And oh, are you there? Hello.
I can hear you clearly now. Can you hear me?
Yes, I can hear you as well.
Okay. So,
Yes, so as I was saying, Dr. Odemela, she's a sister, and I've known her for quite a while now. And I know she's going to be a blessing to us. Of course, she's married with kids, with two herself. So I know you'll be a blessing to us tonight. Thank you very much for honoring our invitation. You have the floor, ma.
alright. Thank you for having me, Dr. Bukayode. It's good to see you again. So this is your face. After how many years now? 2-3 years. Okay? Alright. Good evening, everybody. Dr. Odemela Muluwabukola, as he introduced. It's good to be here again. And then this evening, we'll be discussing an important topic, aging gracefully, aging well in the body, in the mind, and in the spirit. This particular topic that most people run away from, because whenever we celebrate our birthdays and people say, you're growing old, or we are like, no, if you're 40, you say you're 16. We see our men when they are in their 60s and they start having issues. Tell them that this is just part of the symptoms of degeneration. They are very much young. Same with our mothers. When they come down with osteoarthritis, the knees of the joints, and then you tell them this is just a form of degenerative disease that comes with age. They tell you, how old am I? We all say a loud amen to the prayer that our people.
Oh, I think we lost her to the network. Possibly the signal. Let's just wait briefly for her. She's on the back, I'm sure.
Aging. Discussing this topic today, I'll be looking at what is age. In our mind and then spiritually. So aging is a natural process. There's nothing we can do about it. We need to embrace it. This is aging is a process whereby there's a decline in our physical functioning and our mental functioning. And then we tend to present with features that or symptoms that shows increased risk of 50, 60-year-old woman knee pain that they've used that analgesic for, that's pain relieving tablet severally. She keeps coming in and out of the clinic, in and out of the clinic. And then when she comes and she says, degenerative disease, we only keep managing it. The best solution is to probably have an implant so that pain, you'll be off pain. And then she'll look at you and say, how old am I? How can this be as a result of aging? So that's one of the things you see. You see a 60-year-old man telling you that he can't perform as much as he used to. And then you say that he is making of systems. So when we are having changes in our body systems, by staying active, you think when they've gotten to a particular age, they can't pursue their passion. play a guitar, you want to write books, you want to learn how to swim, and then all through your youthful years, you have a particular. During retirement, you can find time to this way you can embrace aging. And then let's try to practice being grateful for what we have. Let us accept what we have. We should be grateful for what we have, and then we shouldn't stress ourselves over what we cannot change about our life. That way we'll be grateful for what we have. And then that way we are embracing aging. Also, let us find purpose in life by sharing our life experiences with people younger than us, and then share wisdom, and then share values for life.
So
healthy eating habits very important. Going
the signal is very, very poor. Hello, are you still there?
body system will be. Yes, I'm there.
It's kind of breaking.
You stop hearing me. Wow.
Yeah, but you're back again now.
Okay.
Back, yeah.
All right. All right. So,
Yeah, you're audible.
can you hear me?
Yes.
Okay. So aging well in the body, let us try to stay healthy by staying active. And
We can't hear you again. We can't hear you again.
wow. Wow. This is Nigeria factor, Dr. Bikari.
What do we do?
What do we do? This is Nigeria factor.
But I can hear you again now.
Right. So where did you stop hearing me?
So you talked about sleeping early.
Okay.
Yeah.
Okay. So regular checkups. If you have chronic disease conditions like hypertension, diabetes, and we're on medications, please let us use our drugs. And we shouldn't just use our drugs. We should go to see our doctor. Let us go for checkups. Let us go for follow-up. Am I audible? Am I still audible? Wow.
Yes, you're
Wow. Wow.
Yes.
I am. Thank God. Okay. So as I was saying, medical checkup is very, very important for those of us with hypertension, diabetes, one form of chronic disease or the other. Please let us use our medications and then let us see our doctors. We need to go and do checkup. Some people are used to taking their drugs by themselves. You also age gracefully. You lost me again. Wow. Oh my
You're back. You're back again.
The network there. You need to tap it. Okay, so aging well in the body. Sensory health. There's all sensory health. You know, we have different senses. The eyes we used to see, the nose we used to smell, our mouth, our tongue, you know, we have taste bud we used to taste, our ears for hearing. This important to all these vital structures I just mentioned. So using of sunglasses due to noise pollution, we can use earbuds. Let us cover up. If we work in a place whereby we inhale all sorts of dangerous substances, let us use mask. Very, very important. All I'm trying to say is that if you want to age well in the body, you need to go extra length. Take good care of your body system. Self-love. Unapologetically, take good care of your body. You understand? So mobility and flexibility for yoga, very, very important too. So aging well in the mind, mental stimulation. You can read, you can play puzzle, you can learn new things. That's what you have for who you are. Very, very important. New things. Also having positive attitudes. Very important. Social connection. Learn to forgive. Nurture relationships with family, with friends, with community, with your neighbors, your church members, your mosque members. Learn to forgive easily. This way you stay at peace. People think when we forgive, we are doing those that offended us a favor. No, we are doing ourselves a favor because we stay at peace when we forgive. So we are never too old to learn. We are never
Go on. We just lost you for a few seconds. Hello. We lost you for a few seconds. Hello. Hello, I can't hear you. I cannot hear you. I don't know if you can hear us. Oh. Yes.
I'm back.
Yeah. So go ahead. Yeah, I can hear you now. Go ahead, please. Okay.
This night. Ah, hello. Am I audible? Wow.
Yes, you're back again.
I'm back again. Okay. All right.
Okay.
Relationship. We need to cultivate this. to pursue passion and interests that bring us fulfillment. We need to leave a good legacy behind. So as I earlier said, being grateful and being thankful, it goes a long way to give us a peaceful mind. And then we will age gracefully in the body, in the mind, and in the spirit. What are the key points? What have I said this night? Aging gracefully. What are the things we need to do? We need to stay healthy. When we stay healthy, we age gracefully physically. How do we stay healthy? Healthy habits, staying active. If you're on medication, you use a drug, go for follow or see your doctor. If you're not on medication, please healthy diet, healthy lifestyle, the acts that help you stay healthy, please go ahead and do them. Social connection. Closer to God. So I want to say, wow, as much as I look forward to enjoying a good session, network has really been an issue. But I hope my audience have been able to pick few things. So I want to say finally that aging is an extraordinary process of growth, not decline. We can actually age gracefully. Let us embrace aging positively. It is not a bad thing. We should, when we embrace it, we accept it, we expect it. Because we are in expectant and we know we are growing older every day, and there's changes in our body system, then we will learn to do the good things that will keep us healthy. When we see wrinkle on our forehead, we should understand what it is. That shouldn't throw us into depression. So I want to say, finally, let us embrace aging and then let us live right. Let us stay peaceful. Let us have social connectedness. Let us move closer to our God and Creator through prayers. Let us learn to forgive others. This way we stay peaceful. I hope I've been able to share one or two things. Dr. Gokayode, thanks for having me.
Yeah, thank you very much. Some of those things you said are very key and they are very vital. Well, the signal has been on and off. I just want to throw a few questions so that you could nail it down and then drive home the points again. Is that okay? Yeah. So I just want to ask that from medical point of view, how can you distinguish between, if there is normal aging and early signs of disease? Sometimes some people feel aging as well. This is part of disease. How can you not I think it's the signal. Yeah, it's this aging or is this disease? You understand? Like, is this aging or is this disease? How can we say, okay, this is aging, this is disease, so that those things can be addressed ASAP? Oh, signal again. Oh.
Okay. I guess we are back.
Yeah.
Okay. Alright. Hello.
Yeah. You're back.
Okay. Alright. So let's start by saying that some chronic disease conditions that we use to see that can be seen young and in the middle age. For example, diabetes, hypertension. Hypertension, like you're having lightheadedness, you feel lightheaded, you're not sleeping well, there's constant headache, you've gone to the clinic, you've been given series of medications, and then on 1 or 2, 3 occasions you've been told that your blood pressure is high. Of course, that's hypertension and it could come early. Along the line, while I was talking about aging gracefully, I don't know if the network allowed us to hear me. I made mention of something like aging is being affected by some factors like genetics, like environment. And that is why sometimes when we see an elderly person that is 120-year-old, the person may be looking like 70 years. And then if you look at the generation of that particular person, you see that that's the way they look. So that's genetics. They always look younger than their age. Another line, you see some people that in their family, they always look older than their age. This person is particular. We are being encouraged from time to go for medical checkup from time to time. You'll be able to pick early signs of disease conditions like hypertension, like diabetes. We have very lumbar spondylosis and lots more. So when you go for regular medical checkups, you'll be able to pick early signs of infections. Now it is different from aging because some symptoms of aging, most of the time, 99% of the time, they do not have symptoms of the body. So in differentiating as an individual without that is not in may not be able to differentiate until you visit your doctor. You need to go to the hospital. So of you having it is very, very. So when you go for your medical checkup regularly, they help you pick it early. Peradventure, if you have this, you start taking your medication, and that will help such that it doesn't throw you into early aging. Because as an individual, you cannot pick it, but a doctor will just tell you, and that you have a chronic conditions. What is conditions? Because as a result of degeneration, because body systems are wearing out, they only need to be managed in order to increase the length of years of that particular individual.
Yes.
If you want to detect any signs
Oh, the signal is not really in our favor tonight.
you can experience
Yes, we lost you for some seconds, but you are back. Well, I think done justice to that question. The other question I want to ask, yeah, the other question I want to ask before we call it a day is, your view on the role of supplements, vitamins in slowing down aging. Supplements, vitamins, what do you think about them? Do you think they really slow down aging? Are they beneficial? And then what's your view on these things? Yeah.
Okay. So you said my view on the use of supplements to reduce aging. Is that it? Did I hear you clearly? Can you hear me?
Yes, I can hear you.
Hello. Okay. All right. As a medical practitioner, I believe so much more, a lot more on the natural things. So I do not readily advocate for supplements. I encourage my patients
Yes, you're back.
okay. So I'm not allowed
You're frozen. Oh, signal is not helping matters at all.
Okay.
Can you repeat?
Okay.
No. No. Oh gosh. supplements. Supplements.
Yes, I encourage plant-based diet. You get lots of nutrients, minerals, micronutrients, vitamins, you get it from your vegetables and fruits.
Okay.
So everybody will go for those natural source of nutrients. The alternative, the supplements we have on alternative source of that.
Okay. Wow. Well, thank you very much for this section. So there has been a lot of back and forth, a lot of technical network glitches.
Yeah.
Yeah, but since it's a video and people can catch up with the play, so I'm sure we'll still be able to learn a lot from your study. Exercise, eat healthy as well, and then have positive you talked about and our health overall. So thank you very much for this beautiful presentation. Even though it's the next podcast, thank you very much for honoring our invitation. I'm sure we are going to have you again.
Thank you for having me.
A blessing to us. And to all of our audience, thank you very much for joining us tonight. By God's grace, our next edition is going to be the next last Sunday in November, and then we're going to be discussing another very important topic. Thank you very much for joining us. Hopefully, we'll see you next time. Do you have any last words for our viewers?
Okay, last question for the viewers. Please explain in response to stay. If you love yourself, you take yourself best care of yourself.